Senator Mike Moon. My name is Meagan Meyer, and I'm one of your constituents from Berry County, Missouri. I understand you also live in Southwest Missouri, and you're probably already aware of the growing substance use problem and the dangers that accompany IV drug use right in our hometown. The Ozarks Health Commission found that over 4% of Medicare recipients were diagnosed with a substance use disorder in Springfield. The Department of Health reported over 1,000 people are living with HIV or AIDS right in our region, and nearly 10% of those are related to IV drug use. Improperly discarded needles spread diseases like HIV, AIDS, or hepatitis, and these diseases further endanger people who use substances as well as their families. Now, we've all seen needles in the parks that our children play in, on busy streets, and even in parking lots and driveways. And when needles aren't properly disposed of, the general public safety is at risk. Syringe access programs save lives by reducing harm, and I urge you to support Senate Bill 623 this session. By helping people who use IV substances to properly dispose of their needles in exchange for new ones, entire communities reduce their exposure to disease. Syringe access programs also provide clients with overdose reversing medications like Narcan. These programs also have professionals on staff ready to make those substance use treatment referrals on the spot. Instead of shaming people who struggle with addiction, syringe access programs reduce the stigma associated with seeking help. They open their doors and say, hey, I know this is hard. We're going to meet you where you're at. Senate Bill 623 already has local support from businesses like Cox Health and the Missouri Family Council. And the Springfield Police Department has been practicing harm reduction already through their use of Narcan distribution. A syringe access program would only further these efforts in our Southwest Missouri community and across Missouri as a whole state. Kansas City and St. Louis have already been operating successful needle exchange programs, but they have to work under a gray area of the law. As it stands, syringe possession counts as criminal paraphernalia possession, and they can be charged for this. The state of Missouri needs to pass a law that allows these programs to openly serve clients without the fear of being shut down. Senate Bill 623 does exactly this. As you participate in the Health and Welfare Committee, I urge you to support SB 623 and to vote to move this bill through your committee. By supporting syringe access programs, you're giving your constituents a safer shot at life.